Welcome back and watching K24 Weekend Edition. It is now time for our lifestyle interview, and this evening we are discussing addiction, a vice that affects so many people, the addicts themselves as well as their family members and friends, and a vice that is affecting contemporary society. So in studio to discuss addiction a little bit further, I'll introduce our guests. We have Amina Aziz, who is a recovering addict. We also have Mark Mbio, who is a recovering addict as well as a counsellor, and we have Dr. Catherine Mutisya, who is a psychiatrist. So thank you all for being here in studio to discuss this very relevant issue of addiction. Dr. Mutisya, let me begin with you. From your professional point of view, how would you define addiction and all the realms it encompasses, which would include, of course, alcoholism and narcotic abuse?
Okay, thank you. In our case, addiction, in terms of addiction to alcohol and other drugs of abuse, is a disorder in which the person using the substance sort of loses control, and whenever they don't use the drug, they get sick, what we call withdrawal symptoms, and it's a disease which could even lead to death. Okay.
All right, thank you for that a definition. So Amina, thank you for being here and willing to talk about your story. How would you describe your experiences, particularly when it comes to substance abuse?
Actually, when it comes to substance abuse, I can say it's the worst. It's a nightmare, especially to women. And there are a lot of women. For me, I used to smoke, then I came back to, I started injecting. So you see, it's a kind of a nightmare, a bad, okay, let's call it, it's kind of a disease. Yeah, doctor? We call it a disease, mental disease, because at that time, someone doesn't know anything, don't understand yourself, don't know yourself, you know nothing. Even if you have kids, don't even give a damn of the kids. All you need is to do the drugs.
So it consumes you?
Yeah,
okay.
It consumes you.
All right, well, thank you for sharing that. Mark, how would you describe your experiences, and particularly when it comes to addiction?
Okay, well, for me, I have many ways of describing what kind of life I've lived, but I would say it's going to a point where I actually lost myself, learned to hate myself. And once I accepted that, finally learned how to love myself again. And when I lost myself is actually when I found myself. So I would say it's getting to a point of, I don't know how to describe it, but just knowing God, I suppose, and grace of God, mercies of God. Because I mean, I can't explain how I kind of got out of that kind of life. There are the things that facilitated for me to get the help, but I mean, it's just as my sister said, it's a nightmare. It's something I'd never wish on even my worst enemy. Yeah, so. Yeah, basically that's what I would say.
Well, it definitely sounds like a journey that you've been on to this point. Yeah, I'm sure we're all still continuing on. Yeah, absolutely. And on this point of a journey, Dr. Mutisya, I'm curious to get your input on the start of this journey, the catalysts, the initiation to addiction. How would you describe this in a lot of the patients and circumstances that you come across? Is it typically a genetic predisposition? Is it circumstantial? For instance, somebody perhaps seeking escapism or depression. What would you say in regards to how this journey to addiction begins?
Actually, the cause is multifactorial. Of course, you've mentioned genetic predisposition for some substances like alcohol use, but again, you need to have been introduced to the substance, bringing in now the environmental aspects, the access, Again, also the psychological issues, because some people will self-medicate when they are facing psychological stress or issues they are not able to deal with. And in young people, we find a lot of peer pressure. They go into it as a result of peer pressure, and before they know it, they get addicted. So it's multifactorial causes.
Okay, so it varies. It's subjective to each case.
Yes.
All right. So on that note, Amina, you know, if you wouldn't mind sharing, how would you describe how you began your journey to where you are now? How you began in interacting with addiction and narcotic abuse?
It started way back about 24 years ago, 23 years ago. And I'll call it bad company. By then I didn't know it was a bad company. A real friend of me introduced me to drugs without me knowing that I'll be hooked in the end. And also love. See, there's a guy who we met when we do share a kid together. Unfortunately, the guy died out of drugs. He overdosed himself. It's a bad experience. On a sincere note, it's a bad experience because I came to be hated even by the community, the society. No one understands that I'm a sick person. All they could see is a culprit. I don't know, I'll tell you, all they could see is an animal. Because when I have the withdrawals, I look like an animal. To me, I'm sick, but to the society, I look like an animal. To my family, to my friends, to all that I've had, you see. I started inside, then I went outside. My friend, after I got hooked, and couldn't get enough money now to buy the heroin, and you have the withdrawal symptoms, all you could do is steal. So I started stealing at home, something small, so I can go and get my fix. Then I went to big things. I ran away from home. Mom died. Now I was in I'm the only daughter with two brothers, two big brothers. I had to steal from them now because mom is not around. Go and sell their mobile phones, their what, so I can get my fix. But then they couldn't understand that I'm a sick person. They had to understand it from outside. That, you know, your sister is doing heroin, you know, your sister is this. They called it believe it at first. They came to believe it when I got arrested while I was doing some shoplifting. I got caught in a supermarket. And imagine, believe it or not, whatever I had stolen there took me to jail for almost a year. And it's a mere a tin of kiwi, 800 grams of kiwi, shoe shine. Took me to 8 months imprisonment in Langata. And it goes for 310. In the black market, I'll sell it at 100 shilling. So as to have my fix. See, that's when my bros came to realize that I'm I'm really doing heroin. Okay, they did what they had to do for me to get out of the jail, because it's not a good thing for I to be there, yet everybody is telling them your sister is in, your sister is. So you see, my big bro, I had to give him he was depressed by me. But then I used to smoke. Then it came to injection. I smoked, it couldn't, now the dose was big. You see, I started from small dose, from one sachet, then I went to grams now. I used to take grams. So I couldn't afford the grams. I had to inject. I go to the pharmacy, I buy a needle, sometimes I share. You see, even I was at risk for contracting HIV. When you inject, it stays more in the body than when you smoke. So that's how I started. That's how I started changing my life. Now myself, the body, physically, emotionally. And okay, I can't describe how I was, but it was a bad beginning to a bad end.
Okay.
Yeah, but then in around 3 or 4 years ago, I met another lady by the name of Salma, who introduced me to a drop-in center by the name of SAPTA. Yeah, SAPTA drop-in. I met another madam there called Catherine Mwangi. She started telling me, oh, you see how you are, introduced, and I have 4 kids, whom I am with them now. They are at home, I know they're saying that's their mom, you see. I had to take Catherine to see my family, to see the way I live, my life in addiction. She was very, very pleased. She was sorry. She told me there's another substance by the name of methadone, which is going to come. Now it's an NGO. They're fighting for a substance by the name of methadone. Now, and with time, she'll introduce me to methadone so as to see whether I can go back as a human being and be accepted back to the family. I say that by the grace of God, like my brother was saying, that's how the grace of God came to my rescue. Because by now I think I would have been dead, long dead. Okay. Because the friend who introduced me to drugs is dead now. She's not alive, she's dead.
Well, I think it's fantastic that you've taken the initiative, to empower your own life. Yeah. And ensure that you don't end up in the same circumstance. So thank you very much for sharing that, Amina. And over to you, Mark. I mean, we've heard Amina talk about, her story and how she began. Would you be open to sharing with us how you began, what your initiation to the journey that you've been through?
Okay. How I began was, basically for me, it was about having fun. My childhood was, I had a good childhood. I had everything. But for some reason, I've never known to date. I used to be picked on in school. I used to be bullied because, I was a bit fat. And for some reason, guys used to take other people's stuff and put them in my desk. And I really didn't understand that. And I used to get into so much trouble. I used to be called a thief. I would deny for so long, but the continuous accusation, I just said, okay, Sawa, I'm a thief. So that, the nagging and stuff could stop. And the guys that bullied me, instead of running away from them, I wanted to be like them. So probably I'd stop. So when it wasn't like earrings, I was the first guy to get an earring in primary school. And when I was drinking, I wanted to drink like them. And so slowly it got into, when I was 13, going on to 14, okay, I did a little bit of weed. And then when I was 14 is when I came to know about heroin. And I did it because I want to become a bad boy and, become the best bad boy there is. I was accepted by them, and that acceptance, just the acceptance, basically, because I never understood why did guys not like me the way I was in school, and I hated myself for that. So I knew I was different. So I started doing the kind of stuff that made me accepted. So it was drinking, was getting high, and I wanted to be the best, and to some degree, I did become the best, because when it came to drinking, at 13, I would leave even much older guys. And, but when heroin came out, the drinking and the weed, just kind of moved out, and I did the heroin. And for me, that was where, I found my hell. But, then I thought it was heaven. And, it just kept getting worse for me. It just kept getting worse. So that's how I started.
Okay, all right. Thank you for sharing that. Dr. Mutisya, it's interesting listening to both Mark and Amina here talk about their own personal experiences. And I'm curious, is addiction usually linked to some sort of psychological trauma or a symptom of something greater, an issue, which hasn't been addressed? Is that usually somewhere within the equation?
Yes, in some cases, especially with the young people, it could just be the curiosity of wanting to know how I would feel if I smoked weed, for example, or how I would feel if I took alcohol. Initially, it could be that. But as I had said earlier, there are some other people who might be having some stress they are dealing with, some psychological issue, like the example Mark has given, that being bullied and sort of you're not able to deal with it, and somehow you find a way of dealing with it. So some people could be trying to deal with some psychological stress they are facing, depression, anxiety. Some people feel like if they are not, when they drink, they can socialize. But when they are not drunk, they are anxious, they cannot initiate a conversation. So it could be mere curiosity when you're starting, or it could be you're trying to deal with some psychological issues which are not resolved.
Okay.
Yes.
So again, it's circumstantial, but these are some of the options that that you've described there. Okay, I'm keen to discuss the treatment because obviously, you know, it's fairly obvious, and also from what both of you have shared, that it can have a devastating effect on the lives of addicts as well as their families. So when we talk about treatment, Amina, you know, you mentioned that you are using a methadone as a treatment option. Could you tell us a little bit more about that?
Okay. To me, I can say that methadone is a golden treatment, or whatever will I call it, a wonder substance from God. Answered my prayers at the end of the day. That's what I can say, because the first I heard about methadone way back. So I told it from a DIC center through a madam called Catherine Syengo. She used to tell me that methadone is an opiate too, which will help me, but at least it's better methadone than heroin. So through the NGOs, and thanks God through the government of Kenya, though they kept us waiting for long, at long last it came. And we came to know about it in December. I started in December 6th in Mathare Hospital. And I started with something like 30 ml. I started with 30 ml. I was given in the morning around 10. I went there when I had withdrawals. I was told not to smoke anything, not to inject anything. I should go there when I'm having withdrawals, so that the doctor can observe me from the start to the end. Yeah. So I went there when I was in real withdrawals. I was given 30 ml. And after 45 minutes, I was told to rest somewhere. Then after 45 minutes, I went back to the doctor, the psychiatrist, Dr. Karanja. I told Dr. Karanja the way I'm feeling. I'm still feeling I can still go and do something. I think I need something. Then she added me another 10 ml. And after 1 hour, I felt, wow, I'm cool. I'm not sneezing anymore. No running nose, no joint pains. Way back, I used to have what would I call them? Flows, abdominal flows, because of withdrawal symptoms. Until I do my fix, that's when the bleeding will stop. So immediately it stopped. I came back to myself now after, let's say, when I do my thing and methadone, now I felt like I've done my thing, yeah? You see, so I was back to normal. I went back home. I was told not to go to do any heroin for the whole day. But I had to do some heroin around 3 at night, 3 a.m. because of lack of sleep, which is part of withdrawal symptoms. So I didn't inject. What I did, I smoked. And I went back in the morning to Mathare Hospital. I told doctor what I did. And what she did, she added me more, because they say that they can't give you, because that's an opiate, and heroin is also opiate. So when you start by small dose, they start by small dose, the methadone. They go by increasing little by little until the gauge reaches you when you feel now you're okay. So they added me another 10 ml and went back home. Now from there, I've been realizing who I am. I've gone back to a human being now. I wake up in the morning, I feel like I want to go to shower, which I didn't do when I was a chunk. I was afraid even of taking bath myself.
Okay.
I was afraid even of being clean.
So it's been quite a journey
Yeah,
for you, and that's been quite significant.
What I can say, methadone is a wonder. Is a wonder
And that's
Was
worked for you.
Yeah.
As we run out of time, I'd really like to sort of hear Mark as a counsellor what you do, but we're running out of time. So on that note, I'll ask each of you for your closing remarks on the issue, particularly you, Dr. Mutisya, in regards to the best options for treatment for people who fall into addiction.
Okay. There's hope because there's treatment available for all the substances. You've heard them mention about heroin treatment and methadone treatment at Madari Hospital. And as much as we are constrained with the numbers, currently we are treating 268 patients, and there are many more people who are in need. Another center has been opened at Malindi, and we are hoping that in Kisumu and also in other places we are going to open, and many people can be assisted. But even the other drugs of abuse, even alcohol, there's treatment. They've mentioned about withdrawal. For you to be able to survive when you have withdrawal, you need treatment, because most people would die if they are not treated, if they try to quit without any medical assistance. So there's always hope, and people need to access treatment. Whenever you find your loved one has reached the stage where they've lost control, they have to, all their time they spend looking for the substance they're addicted to, and whenever they don't take the substance, they get withdrawal symptoms. Take them for treatment.
Okay, so could you just give us and our audience some links to resources, perhaps if somebody would like to get treatment either for themselves or a family member, what options might they have in doing that?
I would say go to the nearest health provider, and if they are not able to give you all the treatment, then they'll refer you. Some people might need residential treatment, others might need outpatient treatment. So eventually when you are treated, you are evaluated by the right doctor, then they are able to advise on what form of treatment. And for those who are might be using heroin, like our colleagues here have said, we at Madari Hospital, they don't come directly. They have to come through the dropping centers like SAPTA, the one she's mentioned. So you don't come directly to the hospital. But even if you come there and inquire, we'll be able to assist you.
Okay.
Yes.
All right, fantastic. We are out of time. So Mark, closing comments?
All I'd say is that, I'm very grateful for what the government of Kenya has started to do. I've been to rehab so many times, like 28 plus times, trying to get sober, trying to get clean. And I would say clean, but after a period of time, I'd relapse and relapse. But when methadone has come, it has really helped me be able to structure my life and be able to be of service, which is what I live for. So, I'm really grateful. All I tell guys out there is, if, you've really tried and tried and tried and doesn't seem to work, just give methadone a try, man. It works. Yeah, it works. That's all I can say.
And Amina, any last comments?
I'll just tell my fellow users, there's still hope. Methadone, God has finally answered our prayers. They should come and get help.
Okay.
Yeah.
All right. Well, thank you all of you for being here in studio, for sharing your stories and also your expertise on a very relevant issue. So thank you very much. And that wraps up our discussion this evening, where we were talking about addiction and its manifestations through alcoholism as well as narcotic abuse. You've heard the stories there, as well as Dr. Mutisya's input and insight into seeking treatment. There is always a way and an option, as we've heard this evening. So that was our discussion.